The Oklahoma Institute for Child Advocacy last week issued a call for the Oklahoma State Board of Education to revisit their vote from July, which failed by one vote to create a statewide masking policy for in-person learning at school. We've approached a critical mass stage with coronavirus, and this happens just as Oklahoma City and Tulsa public schools are going back to in-person learning. Additionally, across the state, with our more than 500 school districts, the Department of Education reports that 20% of those school districts do not have a masking policy in place. This is putting in risk and jeopardizing not only the health and lives of teachers and the staff and personnel in the schools, but also the parents and grandparents who are raising those kids. Oklahoma ranks 9th in the nation for grandparents raising grandkids. The category we would all agree is probably the most at risk. We simply must do better as a state. If the local school districts refuse to implement this, then at least one of those board members with the State Department of Education needs to reconsider their vote and put something in place to guarantee the health and well-being as much as we can humanly possible deliver it to these teachers and those people who are frontline workers in the schools.
COVID affected the medically fragile, but it also affects the economically fragile, and in our case, the academically fragile. And what I'm advocating for is schools being open. The harm being done to our children, especially the under-resourced and underserved communities, is nearly catastrophic at this point. Our students have been, in some cases, out of a classroom for 8 months. This is unprecedented in our recent educational history in our country. We know that communities that advocate for masks are radically less likely to see the wholesale spread of COVID. And none of us are safe, but we know we can slow it and control it when we wear masks. And as a person of at least average intelligence, I just can't understand why grown-ups don't wear masks. It just does not make sense to me. I just don't get it. And I would argue all day long with anyone that if they care for children in Oklahoma, wear a stinking mask. It does not make sense to me. It has enabled us to care well for our teachers and our leaders who want to serve our kids. They want to be in the classrooms. They want to have our doors open. I will tell you that I've been a coach for 28 years, and I am passionate about co-curricular activities as an essential part of the work that we do with our students. The culture and communities that we serve value these. And if you stop wearing masks or if you don't help us, we don't get to have a basketball or wrestling season. It's likely we lose our spring sports again. And this is not just high school athletics. These are the cornerstones of many of our communities, rural and urban. It is essential that we don't devalue these experiences in both the development of our students and within our communities.
Well, as of yesterday, the American Academy of Pediatrics reported nationally that 853,000 children have been tested positive for COVID-B. This is, I'm sure, an underreporting of the number of cases that we've had nationally. Joe gave the information in regards to the numbers in the state. Since March 7th, 127,772 total cases, again underreporting. We've had 1,392 deaths, including deaths of educators. Now, in terms of children, one thing that is a positive is that in most cases, children's disease is not as severe as those of adults. Once you get around 20 years old on up, as a young adult, and particularly as we get up into our senior years, the frequency of severity goes. We also know that the amount of virus load, is the way it's put, that a person inhales does have impact oftentimes on the severity of the pneumonia that a person might experience. It's not always the case, but it can be a big factor. Masks will help control that. That is a helpful thing to keep in mind. In terms of the schools, yes, the children's disease tends to be less severe, but that doesn't change the possibility of infectivity. In fact, it probably makes it even more dangerous because of the fact that the child may show up at school either asymptomatic or mildly symptomatic, and you're not even aware that they are sick, yet they are transmitting the disease.